Welcome back to Washington Watch. I'm Tony Perkins. The website, tonyperkins.com. If you're on Twitter, it's @TPerkins. All right, yesterday, the World Health Organization said countries where coronavirus infections are declining could still face an immediate second peak if they let up too soon on measures to halt the outbreak. Now, how can we restart the economy, get society open again safely? Well, I shouldn't say everybody. Most people agree that the economic consequences of staying shut down would be devastating. We've got to do it. How do we do it right? Joining me now to talk about this, Dr. Martin Makary of Johns Hopkins School of Public Health. He's been on the program before. He's got a piece that he wrote about it's time to reopen, but there's a way to do it safely. Dr. Makary, welcome back to Washington Watch.
Good to be with you, Tony.
So you were advocating early on that, we got to shut things down. We got to slow the spread. But there came a point where you said, all right, we did it. We took our medicine. Now it's time to get open back up again, but we've got to do it in a safe manner.
That's right. The country cannot tolerate a harsh lockdown any longer. It's having an effect on health outcomes on the other end. At the same time, this unfortunately has become a polarized issue, and the answer is somewhere in the middle. We've got to reopen, but we've got to do it carefully. So in the piece I wrote in the New York Times, I basically outlined a strategy of how we can do that based on the background level of the virus threat in a particular community. And that means we need to be careful. It means we need to wear masks when we cannot maintain a social distance. We need to think creatively about redesigning our business processes for the short term until we get to some kind of therapeutic.
All right, let me take this piece by piece. First off, a one-size-fits-all does not work. It's got to be crafted for the needs of that community, that area, correct?
Yes, not all reopenings are created equal, and so everyone's got to be custom tailored.
Now, I want to go to something that's maybe controversial. I don't know, but I want you to unpack it for us, as you do in this piece a bit, and that is the issue of universal masking. You say you talked to medical experts in China where they were able to slow the spread and contain it, and this they pointed to as one of the critical components.
Yeah, absolutely. You know, more and more doctors are recognizing the data on masks, and that's because we're appreciating more that it is from airborne droplets and less from commonly touched surfaces. We even saw the CDC put out a statement last week that it's not as much from touching common surfaces as it is from the airborne droplets. Now, there are micro droplets that people spread when they sing in a choir or speak. Or, some people spit when they talk, others don't. Well, there's always some micro spread of droplets.
So every preacher's got to wear one of those, right? You say others.
Well,
that's a joke. That's a joke. That's a joke
right.
coming from a preacher.
Spitting.
How they like to spit on the front row. So never mind. That didn't go over. Go ahead.
Yeah, if they're really into the sermon, they might need 20 feet or something like that. But. Yeah, so, we're learning more. Look, we didn't have good data going into this pandemic, right?
Right.
We had really poor data from overseas. Some of it was not reported honestly. We didn't know the denominator. We didn't even know how contagious it was. So we threw the kitchen sink at this, and we asked the country to make major sacrifices in March. I was one of those people calling for a shutdown of non-essential activities. But now we need to learn from the data, and we're learning many things. The number one thing is that masks are very effective in reducing transmission. It actually allows us to do a lot of activities that we previously didn't think we could do with the virus in the background.
Okay, tell me, when should people be wearing masks? Where and when should they be wearing masks?
So the number one factor is the background viral load in the community. Okay, if you're living in Palau or someplace with almost no virus, then you know what, live your life. But right now, we're going to have a quiescent summer, and then we may or may not see a resurgence in the fall until we get to a therapeutic, whenever that may be, let's say 9 months to 12 months from now. People should wear masks anytime they cannot maintain 6 feet. That means a busy running trail, you wear a mask. A non-crowded running trail where you're not going to come close to people, you don't have to wear a mask. So it's very dependent.
All right, one other aspect, well, there's multiple aspects, but one I want to draw out. You said spend more time outside.
Yeah, one of the early things that we told people to do that we should not have told people to do is to stay at home. We should have told them, stay on your property, or try to do things outdoors, or simply distance, that is, stay 6 feet clear of other people. So we've learned the outdoors is safer than the indoors. And if you notice, a lot of the southern states really did not get hit as some of the projections anticipated. Many of the hard-hit areas were areas with a long cold season. Illinois, Washington State, Massachusetts, New York, New Jersey, Minnesota is getting hit right now. So you look at these areas, what's common to those areas? People tend to do things indoors. In the southern states, they tend to do more things outdoors, and there's an effect by heat, probably by virtue of increased humidity, which we know is a barrier for transmission.
All right, we're almost out of time, but you also say, look, businesses must adapt. This is more of a market-based approach where if they want people to feel safe, they're going to have to change the way they do business.
Yeah, I hope we can get away from the politicalization of this issue. It's really tragic. Instead of talking about whether or not something should be open or closed, we should be talking about whether or not they can maintain distancing, use good hygiene, and safe precautions. If they can't, a crowded NFL stadium cannot, for example, that means that, that would either have to be modified or just postponed. Other businesses, they can maintain social distance, and so those businesses can function full function. But you look at the meatpacking industry, a good example of an industry with close quarters that needed to be modified.
Yes, true, especially working conditions. But when you look at establishments, restaurants and such, I think people also have to use common sense and not going into places where they feel like they might be at risk.
Absolutely.
And of course, you also talk about the high-risk populations as well. We need to protect them. Great piece. I'm going to encourage people to take a look at it at TonyPerkins.com. Dr. Makary, as always, thanks so much for joining us.
Good to be with you, Tony.